The shocking truth: 12 worst side effects of taking statins. If you're taking statins, there are 12 side effects that affect a significant number of users. Some you might already be experiencing without realizing they're connected to your medication. Knowing what these are could help you better understand changes in how you feel. While statins are widely prescribed and have been shown to reduce the risk of heart attacks and strokes, affecting an estimated 40 million adults in the U.S. alone, a significant number of users report experiencing concerning side effects. Studies suggest that anywhere from 5% to 20% of statin users encounter muscle pain, and that's just one of the more commonly discussed issues. But what about the less talked about, even surprising, problems that could be silently impacting your health? Today, we're not just scratching the surface. We're diving deep into the 12 worst side effects of taking statins, the ones your doctor might not fully explain or perhaps even dismiss. From cognitive fogginess that makes you wonder if you're losing your mind, to unexpected impacts on your energy levels and even your mood, we'll uncover the often overlooked downsides that could be affecting your daily life. It's time to get a complete picture of what statins could really be doing to your body. Disclaimer: this video is intended for educational purposes only and does not constitute medical advice. Always consult a qualified healthcare professional regarding any medical concerns, conditions, or emergencies, and never delay seeking it because of something you have seen or heard in this video. All information presented has been thoroughly researched and verified. You can find source links in the video description. 1. Hepatotoxicity. When statins stress the liver. Hepatotoxicity represents a well-recognized but generally mild complication of statin therapy affecting liver function. The liver, responsible for statin metabolism, can experience cellular stress during drug processing, leading to elevated liver enzymes. Transaminases, specifically ALT and AST, serve as markers of liver cell damage when they leak from injured hepatocytes into the bloodstream. Approximately 1% of patients develop transaminase elevation, exceeding 3 times the upper limit of normal during statin therapy. This elevation typically occurs within the first 3 months of treatment or following dose increases. Most cases represent asymptomatic enzyme elevation without clinical symptoms or signs of liver dysfunction. The elevation often stabilizes or improves with continued therapy, suggesting adaptive liver responses. Severe liver injury remains extremely rare, occurring in approximately 1 case per million patient years of statin exposure. When serious hepatotoxicity develops, patients may experience fatigue, nausea, abdominal discomfort, and jaundice. Jaundice appears as yellowing of the skin and eyes, indicating significant liver dysfunction with impaired bilirubin processing. Dark urine and pale stools may accompany jaundice as additional warning signs. Monitoring protocols recommend baseline liver function testing before starting statins, with follow-up testing if symptoms develop. Routine monitoring during asymptomatic treatment is no longer universally recommended based on current evidence. If transaminase elevation exceeds 3 times normal limits, statin dose reduction or temporary discontinuation may be necessary. 2. Hair loss, alopecia. While statins are widely prescribed to manage cholesterol and reduce cardiovascular risk, few patients are warned about one rare but distressing side effect: hair loss. Medically known as telogen effluvium, this form of diffuse hair shedding can catch individuals off guard, particularly because it typically emerges several weeks or even months after starting the medication. Under healthy conditions, the majority of scalp hairs, around 85 to 90%, are in the anagen or growth phase. A small percentage naturally transition into the telogen or resting phase before eventually shedding. However, certain physiological stressors, including medications like statins, can disrupt this balance. When triggered, a disproportionate number of hairs shift prematurely into the telogen phase, resulting in noticeable thinning and increased shedding. Patients often observe more hair in their brush, on their pillow, or in the shower drain. This type of hair loss is not patchy, but evenly spread across the scalp, making it less immediately obvious, but no less troubling. Fortunately, telogen effluvium linked to statin use is usually temporary. If the medication is discontinued or the body adapts over time, the hair cycle often rebalances itself. Regrowth is gradual, typically beginning within a few months and becoming noticeable after about 6 months. Still, this reaction should not be dismissed as merely cosmetic. Hair thinning can serve as an external signal of deeper internal imbalance or stress. In some cases, prolonged shedding may be exacerbated by additional factors such as iron deficiency, thyroid dysfunction, or systemic inflammation. For this reason, unexplained hair loss should prompt a full review of current medications, lifestyle, and health status. If you're experiencing unexpected hair thinning and are on statins, speak with your healthcare provider. Identifying the root cause early can prevent further loss and support healthy regrowth. 3. Hemorrhagic stroke. While statins dramatically reduce your overall stroke risk, they create a complex neurological paradox. These medications excel at preventing ischemic strokes caused by blood clots, but may slightly increase your risk of hemorrhagic strokes caused by bleeding in the brain. Hemorrhagic stroke occurs when blood vessels in your brain rupture, allowing blood to leak into surrounding brain tissue. This bleeding creates pressure that damages or destroys brain cells, potentially causing permanent neurological deficits or death. The mechanism behind statin-associated hemorrhagic stroke remains incompletely understood. Some researchers theorize that aggressive cholesterol reduction might weaken blood vessel walls, making them more susceptible to rupture under pressure. The most characteristic symptom is sudden onset of severe headache, often described as the worst headache of my life. This thunderclap headache differs dramatically from typical tension headaches or migraines in its intensity and sudden appearance. Additional symptoms include sudden weakness or numbness on one side of your body, difficulty speaking or understanding speech, vision problems, dizziness, and loss of coordination. Unlike ischemic strokes that develop gradually, hemorrhagic strokes typically present with rapid symptom onset. The risk remains extremely rare, but the consequences are devastating. Hemorrhagic strokes have higher mortality rates than ischemic strokes and often result in more severe long-term disabilities among survivors. Fourth, kidney damage statins are among the most commonly prescribed medications for lowering cholesterol and reducing cardiovascular events. While they are generally safe and effective, in rare circumstances, statins can indirectly lead to kidney damage, primarily through the development of rhabdomyolysis. Rhabdomyolysis is a potentially life-threatening condition marked by the rapid breakdown of skeletal muscle tissue. This breakdown releases substances such as myoglobin, creatine kinase, and electrolytes into the bloodstream. Myoglobin, in particular, can accumulate in the renal tubules, obstructing them and generating oxidative stress, both of which contribute to acute kidney injury, AKI. Importantly, this type of kidney injury is not caused by a direct toxic effect of statins on the kidneys. Instead, it is a secondary complication resulting from extensive muscle damage. True statin-induced kidney injury without concurrent muscle breakdown is exceedingly uncommon and warrants thorough evaluation for other possible causes, including pre-existing renal disease or interactions with other nephrotoxic agents. Clinicians should remain vigilant for early signs of rhabdomyolysis, such as severe muscle pain, unexplained weakness, or dark-colored urine. Early detection and prompt intervention, often involving discontinuation of the statin and aggressive hydration, are critical to preventing progression to kidney damage. Patient education, routine monitoring, and a careful risk-benefit assessment are essential components in the safe, long-term use of statins. 5. Neurological effects, memory loss, confusion. The brain-statin relationship presents one of the most controversial aspects of statin therapy. Patients frequently report experiencing what medical professionals term cognitive impairment while taking these medications. Memory loss manifests as difficulty recalling recent events, forgetting familiar names, or losing track of conversations mid-sentence. Forgetfulness extends beyond normal age-related changes, affecting daily functioning and professional performance. Confusion involves disorientation about time, place, or circumstances that were previously familiar. Patients describe feeling mentally fuzzy or experiencing difficulty concentrating on tasks requiring sustained attention. The FDA acknowledged these reports by adding warnings to statin labels, noting that cognitive symptoms are uncommon, generally not serious, and typically reversible within weeks of discontinuation. 6. Peripheral neuropathy, nerve damage. Peripheral neuropathy involves damage to nerves outside your brain and spinal cord, creating a constellation of sensory symptoms that can significantly impact your quality of life. The condition typically begins with tingling sensations in your fingers and toes, often described as pins and needles feeling. This paresthesia gradually progresses to numbness, creating areas where you lose normal sensation to touch, temperature, or pain. As neuropathy advances, you might experience burning pain, electric shock-like sensations, or stabbing pains that worsen at night. Some patients describe feeling like they're wearing invisible gloves or socks due to the altered sensations. Balance problems develop when neuropathy affects proprioceptive nerves responsible for position sense. You might feel unsteady when walking, especially in dark environments where visual cues can't compensate for impaired position awareness. Fine motor control deteriorates as neuropathy progresses. Simple tasks like buttoning shirts, writing, or picking up small objects become increasingly difficult. Some patients drop items unexpectedly due to reduced grip strength and sensation. The mechanism of statin-induced neuropathy likely involves interference with nerve cell membrane function or cellular energy production. Cholesterol plays important roles in nerve cell membrane integrity, and excessive reduction might compromise nerve function. While typically not life-threatening, peripheral neuropathy can become a chronic condition that persists even after statin discontinuation. Early recognition and prompt medication adjustment may prevent permanent nerve damage. 7. Inflammation of the pancreas. Your pancreas serves dual functions as both a digestive enzyme producer and hormone manufacturer, including insulin production. Statin-induced pancreatitis represents acute inflammation of this critical organ with potentially life-threatening consequences. Pancreatitis typically begins with severe abdominal pain located in the upper central portion of your abdomen, often radiating through to your back. This pain intensifies when lying flat and may improve slightly when sitting forward or curling into a fetal position. The inflammation occurs when digestive enzymes normally released into your small intestine become activated while still inside the pancreas. These powerful enzymes literally begin digesting the pancreatic tissue itself, causing intense pain and potentially serious complications. Nausea and vomiting accompany the abdominal pain, often becoming persistent and preventing you from keeping food or fluids down. Fever develops as your immune system responds to the inflammatory process. Severe cases can progress to necrotizing pancreatitis, where portions of pancreatic tissue actually die. This complication can lead to infection, abscess formation, and multi-organ failure requiring intensive care unit management. Chronic pancreatitis may develop if inflammation persists or recurs repeatedly. This condition permanently damages the pancreas, potentially leading to diabetes mellitus due to insulin-producing cell destruction and malabsorption of nutrients due to inadequate digestive enzyme production. 8. Increased blood sugar and new onset. Type 2 diabetes statins create a paradoxical situation in your body's glucose metabolism. While protecting your heart from cholesterol-related damage, they simultaneously increase your risk of developing type 2 diabetes mellitus. The Jupiter trial revealed compelling evidence of this diabetogenic effect. Among participants taking rosuvastatin, 3.0% developed new-onset diabetes compared to 2.4% in the placebo group over 1.9 years. This difference, while statistically significant, translates to one additional diabetes case for every 255 patients treated for 4 years. Meta-analyses examining multiple clinical trials calculated an odds ratio of 1.09 for developing diabetes with statin therapy. This means statin users have approximately 9% higher odds of developing diabetes compared to non-users. The risk varies considerably among different statins. High-intensity statin therapy and higher doses amplify this diabetogenic risk. Rosuvastatin, atorvastatin, and simvastatin demonstrate the strongest associations with new-onset diabetes. Conversely, pravastatin and lovastatin show lower risks, while pitavastatin appears to have no increased diabetes risk. The mechanism involves interference with glucose metabolism pathways and potentially reduced insulin sensitivity. Pre-existing risk factors including prediabetes, central obesity, hypertension, and genetic predisposition significantly amplify your vulnerability to statin-induced diabetes. 9. Thrombocytopenia. The hidden blood risk of statins. Thrombocytopenia is a potentially dangerous condition characterized by an abnormally low number of platelets, small, disc-shaped cells essential for blood clotting. Without adequate platelet levels, the body struggles to form clots effectively, which increases the risk of excessive or spontaneous bleeding. While there are many causes of thrombocytopenia, certain medications, including statins, have been associated with rare but serious cases of drug-induced thrombocytopenia. This adverse effect is often overlooked due to its subtle onset. Early warning signs may include frequent nosebleeds, unexplained or prolonged bruising, bleeding gums, or an unusual delay in stopping bleeding after minor cuts. One telltale sign is the appearance of petechiae, tiny, flat, red, or purple dots on the skin that result from minor bleeding under the surface. These can be mistaken for a rash or allergic reaction, but may signal a significant underlying blood issue. In some cases, statins can trigger an immune-mediated response where the body's immune system mistakenly targets and destroys its own platelets. This immune reaction leads to a sudden and sometimes dramatic drop in platelet count. If left unchecked, severe thrombocytopenia can result in internal bleeding, gastrointestinal hemorrhage, or even life-threatening complications, such as bleeding in the brain. Fortunately, early detection is possible with a standard blood test that measures platelet levels. If the condition is identified and linked to statin use, discontinuation of the drug typically results in recovery. However, more severe cases may require treatment with corticosteroids or other immune-suppressing therapies. If you are taking statins and notice unusual bruising, prolonged bleeding, or unexplained skin changes, it's vital to speak with your healthcare provider promptly. Thrombocytopenia is more than a minor side effect. It's a serious but treatable condition that should not be ignored. 10th, rhabdomyolysis, the silent muscle destroyer. Rhabdomyolysis represents the most severe and potentially life-threatening complication of statin therapy. This condition involves the rapid breakdown of skeletal muscle tissue, releasing muscle proteins directly into the bloodstream. When muscle fibers deteriorate, they release myoglobin, a protein that can overwhelm the kidney's filtering capacity. The cascade of events begins when muscle cells lose their structural integrity. Myoglobin floods the circulation, creating a dark, cola-colored urine appearance called myoglobinuria. This protein acts like microscopic debris, clogging the kidney's delicate filtration system and potentially triggering acute renal failure. Electrolyte imbalances accompany this process as potassium, phosphate, and other cellular contents spill into the bloodstream. These disruptions can cause dangerous heart rhythm abnormalities. The condition affects approximately 1.5 per 100,000 statin users annually, but the risk escalates dramatically with higher doses and specific drug combinations. Early warning signs include severe muscle pain, weakness, and dark urine. Patients may experience nausea, vomiting, and confusion as kidney function deteriorates. The condition demands immediate medical intervention, often requiring hospitalization with intensive monitoring, aggressive fluid replacement, and sometimes dialysis to preserve kidney function and prevent cardiovascular complication. 11th, sexual dysfunction. Some patients taking statins report reduced libido or erectile difficulties, though these are considered uncommon side effects. Current evidence does not support a direct causal link between statins and sexual dysfunction. Symptoms may be due to underlying cardiovascular disease, psychological factors, or the nocebo effect. As with other debated side effects, it can be difficult to distinguish between drug-related and unrelated symptoms. Patients should consult their doctor if concerns arise, as treatment adjustments may be possible. 12th, severe gastrointestinal disturbances. Gastrointestinal side effects are common with statin use, usually mild, such as nausea, diarrhea, or indigestion. However, in rare cases, they can become severe, leading to intense abdominal pain, persistent vomiting, gastrointestinal bleeding, or symptoms similar to gastritis or pancreatitis, potentially requiring medical attention. Severe gastrointestinal side effects from statins are uncommon, but clinically important, especially when they affect treatment adherence or patient confidence. While mild symptoms like nausea or indigestion are well known, severe cases, such as persistent vomiting or abdominal pain, are less studied and not fully understood. Possible causes include bile acid changes, gut microbiota disruption, or stomach irritation. Though rarely dangerous, unmanaged symptoms can cause dehydration or nutritional issues. Dose adjustments or switching statins can often help manage these effects. Found this helpful? Hit like, share it with others, and subscribe for more simple health tips.